आपण स्टार्ट करूया कार्यक्रम. अंजली मॅम.
Hello, Navneet, are you there?
Yes, ma'am.
Navneet,
Hello,
please
yes,
start the
ma'am.
program.
Yes, ma'am. Just a moment.
Okay.
Hello. Ma'am, am I audible?
Yes, no.
Okay. Good morning, all. Myself, Navneet Jha from SYBSc Regular, SARHAD College of Arts, Commerce and Science. Today, we all are here gathered to attend the guest lecture organized by the Department of Physical Education and Sports and IQAC, which is based on COVID-19 pandemic pain about our health and fitness, which will be given by our honorable speaker, Chinmoy Panigrahi Madam. Now, I would like to welcome our honorable chief guest and today's speaker, Chinmoy Panigrahi Madam, on behalf of our college. I would also like to welcome our respected principal, Dr. H.R. Jadwar sir, our vice principal, Dr. S.S. Shinde Madam, our physical director, Dr. Pritam Misade sir, Assistant Professor Aparna Kedari Madam, who is also the HOD of our science department, Assistant Professor Anjali Aranke Madam from Department of Chemistry, and all my dear friends. So, without wasting much time, now I would like to call Renuka Jankar from TYBSc Chemistry to give a brief introduction about our today's chief guest. Renuka, over to you.
Thanks, Navneet. Hello, am I audible?
Yes, Renuka, you are.
Okay. Okay, ma'am. Thank you. Let's make it start. Good morning, everyone. And at first, thanks for giving me this opportunity to introduce our today's guest speaker. I am Renuka Zankar from third year of BSc Chemistry class. Before I take the pleasure of introducing our guest speaker, please allow me to express my gratitude to our respected principal, Dr. H.R. Jadwar sir, to our vice principal, Sangeeta Shinde ma'am, and HOD of Science Department Assistant Professor, Mrs. Aparna Kedari ma'am, to our physical director, Dr. Pritam Misade sir, and Assistant Professor, Mrs. Anjali Aranke ma'am, and to the entire working group for all their hard work in planning this webinar today. And of course, all of my friends have joined. Welcome to the Enterprise New virtual event. I'm super excited to have you here. Excited about all the amazing conversation that we are going to have today. Our guest speaker will give some information regarding pandemic pain and improvement in health and fitness. Joining us today is an amazing visionary, and when I say amazing, I mean it. She is a master in pattern. She has attended many workshops and conferences. She is honored by many awards and currently awarded as Young Researcher and Young Scientist in 2021. She has 2 years wonderful experience. And what's special about her is that she loves Kathak dancing, singing, like to write, read, and travel. So, let's welcome our today's guest speaker, Miss Mrunmayee Panigrahi ma'am. We all are very grateful to have you here, ma'am. So, without consuming any time, I would like to call upon Mrunmayee ma'am to enlighten us with her words of true wisdom. Over to you, ma'am.
Good morning, everyone. I hope I'm audible.
Yes, ma'am.
Yes, ma'am.
Yes.
Yes, ma'am.
I would request a very small thing from you. I hope you could switch on your cameras so it could be a bit more interactive. In case आपको आवाज नहीं आए, so you can always switch it off in between. There's no issues about it. Thank you so much. Okay, so basically regarding our today's topic, I just want to know आप लोग कौन से year में हो? First year, second year, third year, or this is a mixed group?
UG and PG courses.
UG and PG. Okay, fine. So you're pretty much well aware about the situation that we are going through. Since the pandemic has hit us from 2019, I have currently seen a lot of children coming to me with pain in the neck and the back. And by children, I don't mean UG and PG. You people are at least above 18. Those people are only 11 years old. So what trying to say is the current situation has put us through a lot of things. It's not only financial, it's not only all in terms of education, it is in terms of health also. Our outgoing, like people who are very outgoing, those people are not able to go out. Those people who were introverts and at least used to indulge in some activities are now not doing it anymore, or maybe they just lost interest for doing it, and these has led to a lot of problems, including few of them is pain. And that pain is not only limited to your back and the neck. People are also getting shoulder pain, they are getting knee pain, and that is in a very very small age, as I already discussed, by 11 years old. Okay, now, a quick introduction about myself. My name is Dr. Chinmoy Panigrahi. I am basically a master's in physiotherapy, musculoskeletal, and sports. And currently, I am a senior therapist at Arcus Hospital, Vanavari. And basically, I used to be an academician about 4 months back. So I used to teach in a college. I was an assistant professor. And now I'm pursuing my PhD in the same course. So without wasting much of your time, let's start with the presentation. Please let me know if you are able to see my screen. Are you able to see this?
Yes, ma'am. Yes, ma'am.
Everybody can mute yourself for some time. It won't take much of your time. So if you can can see there are two people over here. One is sitting very casually and in a very comfortable position, what we may say, and one is sitting very uptight, in a very erect position. But what we don't realize is this slouched posture that gives us comfort is actually causing a lot of pain in these areas: the neck, the upper back, the lower back, and in the wrist. And also, it causes pain in the knees, it causes muscle tightness over here. And that's why our topic is known as pandemic and pain, all the pain that is created in this pandemic. Now, starting with a very basic definition, what is posture? What do we think posture is? So, it is defined as an attitude that is assumed by the body either with support during the course of muscular activity or as a result of the coordinated action performed by a group of muscles working to maintain the stability. In nutshell, right now, whatever you are doing, in whatever manner you're sitting, and that particular attitude of your body is your posture. So your muscles may be working right now to make you sit upright, or maybe somebody is slouching on the chair or on the desk, somebody is sitting like this, and this entire thing sums up to your posture. It can be dynamic and static. Dynamic is when you are trying to walk, when you are trying to run. Every transition, there is a change of muscle work. So when you are walking, when one foot is at the front muscles of that particular leg is working, while the back muscles of the other leg is working to maintain the stability. So dynamic postures is a power play, is an interplay between the muscle activity and the stability muscle activity. So one is creating a stability on which you are moving. Static is basically right now what we are doing. We are sitting. So static, as it says, it is not moving. It is at one place. It can be while lying down, sitting, standing, just being in one position. Okay. So this is how you hold yourself when you are not moving. And then it is again divided into good and bad posture. Now, what is a good posture? A good posture ideally should be comfortable. So if I tell you that you have to stand or erect, or you have to, sit erect, and you have to sit upright with your shoulders back, few of will also try. You will be trying, like you'll be taking your shoulders back, you'll be taking your chin in, and while doing so, you may not feel very comfortable because your muscle is not activated that well to hold that posture. And if you push yourself through and through, you will only experience a pain. So it should be very comfortable and it should be aesthetically pleasing. Why I'm saying aesthetically pleasing? When you meet somebody out, or when you see someone who is having a good posture, you're always, you always fancy being with them. You always think, oh, okay, there is some positive vibe with this person. Somebody is walking very smart towards you with a broad shoulder and with all the shoulders back in a good manner, with the erect spine, the spine is correct. But imagine meeting a person who just walks like this. Can you imagine Bagha Mehta Ka Ulta Chashma? How many of you watch? Am I audible?
We all watch that one.
Okay. So you are aware about the character Bagha. Have you seen how he stands? Okay. So if you meet somebody like that, the first thing that comes to our mind is he having pain somewhere, or is he having some trouble? Okay. So that posture is not aesthetically pleasing. It doesn't pleases your eye. It doesn't look good to see. And the muscle work is optimal. Optimal as in it is not more, it is not less. It is optimum. Okay, so I'm sorry. Can you mute yourself?
Anupama ma'am, please mute your mic.
Okay, So muscle activity is optimum. It hasn't to be कि बॉडी के सारे मसल्स एक साथ काम कर रहे हैं, या ऐसा भी नहीं होना चाहिए कि कुछ काम नहीं कर रहे हैं. So it is an optimum muscle work where the muscles are also not tired to work. So if you see this girl sitting over here, she also looks happy. This boy, he also looks happy. But if you see her reading the book, she seems much more aesthetically pleasing because she's sitting with a good posture. This boy is probably very happy about his posture, but it is not good ideally. If you see, the back is rounded, he's too much slouched, okay, he's too much relaxed. At some point, his head will start aching. So, bad posture is usually uncomfortable. नीड नॉट नेसेसरी कि अनकंफर्टेबल मतलब आप अभी बैठे हैं और वो तुरंत ही आपको पेन देना शुरू कर दे, बट फॉर अ लॉन्ग टाइम इट विल बी अनकंफर्टेबल. इट लुक्स अनप्लेजेंट and muscle works causes pain. So the muscle will be working, but it will cause pain eventually. Now, if you see, this is just a photo of how a good posture and a bad posture should look. Any kind of poor posture creates a lot of problems. If you see in this uh, picture, which is summarizing a lot of issues: plantar fasciitis, back pain, neck pain, headaches, acid reflux, knee pain, hip pain. So these are some of the issues that are caused by this posture. You may not even realize कि आपको अचानक नी में पेन क्यों हो रहा है. I'm not even running, I'm not even jogging, I'm not doing any physical activity, but I am having knee pain. And later on, when you are assessed, it is found out that आपके मसल्स जो हैं वो काफी वीक हो चुके हैं. पहली चीज क्योंकि आपकी लाइफस्टाइल सेडेंटरी थी. दूसरी चीज क्योंकि आप नी हमेशा बेंड रख के बैठते हैं. मतलब whenever we are sitting, we are bending the knees. Half of the time is gone bending the knee. Okay, half of the time is gone keeping our foot in one position. Half of the time or half of the day is gone with our lumbar spine or our back in a certain position, that is in a bent position. I'm sitting, my spine is bent right now. So I'm using my laptop, my upper back is slouched. So that should not happen. And these things all cause a poor posture and then these problems. So, how do we know if posture is good or not? How do we assess? So, there is something known as line of gravity. Our body has a concentrated center of gravity. In fact, every body, every object that has mass, उसका अपना एक center of gravity होता है. तो center of gravity क्या होता है? ये एक ऐसा point है जहाँ पे बॉडी का सारा मास या सारा का सारा वेट कॉन्सेंट्रेटेड रहता है, जिसपे आपका ग्रेविटी काम करता हो. मतलब आपका ग्रेविटी का जो पुल आता है वो मैक्सिमम इस पॉइंट पे आता है. इन ह्यूमंस इट इज समवेयर नियर द लोअर बैक रीजन. नाउ a imaginary line that passes from this center of gravity is known as your line of gravity. तो अगर आप ये रेड डॉट्स देख रहे हैं यहाँ पे, तो ये जो रेड डॉट्स हैं ये बताते हैं कि ये जॉइंट्स हैं. ये जो है ये आपके कानों का एरिया है जहाँ पे आपका अकाउस्टिक मीएटस होता है, जहाँ से मतलब जहाँ पे आप ईयरफोन्स डालते हैं. सो दैट इज द ऑडिटरी कैनल. ये आपका शोल्डर जॉइंट है, ये आपका हिप जॉइंट है, ये नी है, ये एंकल है. अगर आप ये लाइन देखें तो नॉर्मली ये लाइन ये पास करती है आपके ईयर्स से, शोल्डर जॉइंट के थोड़े से सामने से, सेंटर ऑफ ग्रेविटी के एकदम बीचों बीच, हिप जॉइंट के थोड़ा पीछे, नी जॉइंट के थोड़ा सा आगे और एंकल जॉइंट के आगे. ये लाइन ऑफ ग्रेविटी आइडल है. मतलब दिस इज एन आइडियल वे एक पॉस्चर होना चाहिए अगर आप सीधे खड़े हैं. दिस वी असेस यूजिंग अ टूल नोन एज प्लम लाइन एंड वी सी कि आपका पॉस्चर अच्छा है या नहीं है. अगर नहीं है तो हम उसे सुधारते हैं. नाउ द कॉन्सेप्ट इज कि लाइन ऑफ ग्रेविटी जहां से पास होता है उसके ऑपोजिट ऑफ ग्रुप ऑफ मसल्स को ज्यादा काम करना पड़ता है. सो इफ यू सी कि यहाँ पे जो है आपका लाइन ऑफ ग्रेविटी बैक के आगे से जा रहा है, आपके शोल्डर जॉइंट के आगे से जा रहा है, आपकी ईयर के आगे से जा रहा है, एंकल के आगे से जा रहा है. इसी वजह से बैक का जो ये पूरा हिस्सा है, मतलब आपका अपर बैक, आपके बैक के एक्सटेंसर्स, मतलब आपको जो सीधा करते हैं वो मसल्स, आपके हिप के मसल्स, आपके नी के मसल्स एंड एंकल के मसल्स, ये ज्यादा काम करते हैं कंपेयर टू द फ्रंट मसल्स, ताकि आपको सीधा खड़ा कर सके। और यही रीजन है कि आपको ज्यादातर पेन इन्हीं एरियाज में होता है। इंस्टेड कभी किसी को सुना है कि पोस्चर की वजह से पेट दर्द हो रहा है, या आपको यहाँ ऊपर की तरफ इधर पेन हो रहा है? मोस्टली पोस्चरल प्रॉब्लम्स में जो पेन होता है वो हमेशा पीछे की तरफ ही होता है। द रीजन इज कि लाइन ऑफ ग्रेविटी जो है वो ज्यादातर आगे की तरफ से पास कर रही होती है। सो द की टू गुड posture is the position of the spine. The spine has three neutral curves at your neck, upper back and lower back. Correct posture should maintain these curves. तो कोई भी correct posture ये curves को maintain करना चाहिए. Our head should be above the shoulders and top of your shoulder should be over the hips. तो ये जो है shoulder exactly over the hip and head exactly over the shoulder का position जो है वो होना चाहिए, वो maintain होना चाहिए. So if I just tell you this slide, तो हमारे जो shoulders हैं वो line में होने चाहिए, हमारा जो eye level है वो एक level पे होना चाहिए, ears एक level पे होना चाहिए, hip bone एक level पे होना चाहिए, दोनों knees level पे, दोनों ankles level पे. If I see a frontal view. Now poor posture can be bad for your health. How? So it misalign your musculoskeletal system, मतलब आपके पूरे बॉडी के मसल्स और बोन्स का जो अलाइनमेंट है वो काफी बदल जाता है। क्योंकि अगर आप ज्यादा देर ऐसे बैठते हैं या राइट की तरफ या लेफ्ट की तरफ झुक के बैठते हैं, तो आपके राइट साइड के या लेफ्ट साइड के मसल जिस तरफ आप झुक के बैठे हैं वो थोड़े शॉर्टन हो जाते हैं, और जो लेफ्ट साइड के या राइट साइड के मसल हैं जिसके अगेंस्ट आप झुके हुए हैं वहां पे थोड़ी लेंथनिंग आ जाती है, या वो मसल्स थोड़े लेंथ में लंबे हो जाते हैं. Our muscles are as good as any elastic material, so they have elasticity. So you can imagine अगर एक रबर बैंड है जिसको आप नया रबर बैंड लेकर आते हो, आप उसको रीयूज करते रहते हो, वो काफी एक्सपैंड हो जाता है. इन सिमिलर फैशन आप मसल को स्ट्रेच करते जाओगे तो वो स्ट्रेच होता जाएगा. अगर आप उसको एक ही पोजीशन में रखोगे तो उसको अडेप्टिव शॉर्टनिंग आ जाएगी, क्योंकि वो मसल ज्यादातर उसी पोजीशन में रह रहा है. It increases pressure on the spine, making it more prone to injuries and degeneration. Neck, shoulder, back pain जो है वो काफी कॉमनली होते हैं posture की वजह से. आप में से कई लोग ऐसे होंगे जिनका posture होगा कि शोल्डर जो है वो फ्रंट की तरफ ऐसे होंगे या ऐसे ऊपर की तरफ होंगे. आपका जो ईयर है it will be out of your shoulder, giving you a forward chin position. And those people most commonly must be having nothing than this area का pain, that is the upper neck का pain. या उनको headaches जो होंगे बहुत commonly होंगे. And if you try to palpate your head over here, just at the back of your where the neck starts, whenever you palpate it, whenever you touch it a bit more hardly, you'll feel a pain, because वहां पे जो मसल है वो काफी टाइट हो गई होती है. It decreases flexibility. कुछ मसल्स जो बहुत प्रोन होते हैं फ्लेक्सिबिलिटी के लिए वो होते हैं नी के पीछे के मसल्स, जिन्हें हम हैमस्ट्रिंग बोलते हैं. काफी लोग जो जिम जाते होंगे उनको आइडिया होगा हैमस्ट्रिंग ग्रुप ऑफ मसल्स किन्हें कहते हैं. दैट इज योर बैक ऑफ थाई मसल. अफेक्ट हाउ वेल जॉइंट्स मूव. जॉइंट्स की मोबिलिटी कम हो जाती है क्योंकि आप मूवमेंट नहीं दे रहे हैं. अफेक्ट द बैलेंस एंड इंक्रीज द रिस्क ऑफ फॉलिंग. हमारे जितने भी जॉइंट्स हैं उनमें रिसेप्टर्स होते हैं. सो व्हाइल यू आर वॉकिंग एंड टॉकिंग टू योर फ्रेंड, यू डू नॉट टम्बल डाउन, या आप गिर नहीं जाते हो. आपका ध्यान होता है, आपको पता है मैं चल रही हूँ या चल रहा हूँ. दैट इज बिकॉज ये जो रिसेप्टर्स होते हैं ये उसको करवाते हैं. These receptors sense the ground, these receptors sense the movement, and it constantly passes the message to the brain. But when you are constantly sitting in one single posture, आपके जो जॉइंट की मूवमेंट है वो कम हो जाती है. तो एक कांस्टेंट सिग्नल आपके ब्रेन की तरफ से ये जाता है कि मूवमेंट कम है. धीरे धीरे ये रिसेप्टर्स काम करना बंद कर देते हैं. एजिंग के साथ कम हो जाते हैं, लेकिन अगर एज नहीं है, आपकी लाइफ सेडेंटरी है, तो ये काम करना बंद कर देते हैं, रिस्पॉन्ड करना बंद कर देते हैं. इट इज एज गुड एज यू इग्नोर्ड देम, सो नाउ दे आर हर्ट. ओके, So that is how they are going to affect the balance, and it increases the risk of fall. It makes it harder to digest food. It is a well proven fact. Okay, so when we are moving, our digestion is improved because we burn calories when we are moving. We need energy to move. It makes it harder to breathe, and ultimately all this thing altogether decreases the endurance of your heart and your lungs, क्योंकि अब they are lazy. Now they know I have to sit for 8 hours only. I don't have to pump enough blood. तो जैसे ही आप चलना शुरू करते हैं, you will be breathless. Your body adapt to what you give and what you put. So आप जैसा posture उसको दोगे, वो उस हिसाब से काम करेगा. Now what causes all these? ये posture तो खराब हो रहा है. क्या क्या reasons है कि posture खराब हो सकते हैं? First is genetic. Now that is something which I cannot blame on, because for genetic है. The child was born with some bony defects or muscle malalignments. Okay. Then there is muscle weakness, which could be present because physical activity nahi ho. Yeah, you are just in your growing years. You're very small and you never actually put some effort to bring that muscle to action. And the very common reason these days is post pandemic, we are sitting more. Why? We don't have anywhere to go. We don't have anything to do. Okay? हमारा खेलना बंद हो चुका था काफी हद तक. अभी तो थोड़े बहुत फिर भी restrictions हट गए हैं. So you are consuming a lot of time in front of your screen. आपका screen time increase हो गया because with your online lectures, online classes, you're mostly in front of the screen. So poor awareness and knowledge of the posture. मोर स्क्रीन टाइम के बाद आपकी अवेयरनेस या नॉलेज पोस्चर को लेके बहुत गलत है या फिर है ही नहीं. सो आप बैठते हैं, आपको लगता है ये कंफर्टेबल पोजीशन है, यू कंटिन्यू इन दैट पोजीशन. नाउ अटेंडिंग अ लेक्चर कुड बी हार्श. आप 1 घंटा, आधा घंटा, पौना घंटा एक लेक्चर ले रहे हैं, और ऐसे आपको अगर दिन के 3 से 4 लेक्चर ले रहे हैं विदाउट एनी ब्रेक्स, दैट इज गोइंग टू क्रिएट अ प्रॉब्लम. Sedentary lifestyle, that is no activities at all, and psychological stress. That means you are mentally depressed, mentally ill, or you are sad about something or hurt about something that ultimately depresses your mood to do anything. That makes you low key. Post pandemic, everything is online, screen time is increased psychological load. Most of the time, you are in one posture. You have a disturbed sleeping pattern because we have Netflix to chill, and we have a disturbed eating patterns because we stay up late. Cause of pain, especially neck and back. Poor body awareness has created, and this has created a loop, and this loop is going to give you more pain. So it's basically you are spending more time in front of the screen, your posture is going bad, your muscles are getting weaker, giving you pain, and that pain is again creating a poor posture because now you have pain, so you cannot sit straight, because every time you sit straight you feel that pain. So effects of increased screen time. क्या क्या होता है अगर हम लोग स्क्रीन टाइम बढ़ा रहे हैं? लाइक अगर हम लोग लेक्चर अटेंड नहीं कर रहे तो हम ज्यादातर फोन पे हैं. अगर हम फोन पे नहीं हैं तो हम टीवी देख रहे हैं. तो उसकी वजह से एक फिजिकल स्ट्रेन आपकी आंखों में भी आता है, आपके बॉडी पे भी आता है. स्लीप डेप्रिवेशंस, आपको नींद अच्छी नहीं आती, या एवरी टाइम देयर इज अ रेस्टलेसनेस एंड एंजाइटी. इंक्रीज्ड रिस्क ऑफ ओबेसिटी, susceptibility to chronic health conditions like increased BP, increased sugar, loss of cognitive abilities. That is, your time span is only about 15-20 seconds already. Why? We are so consumed in all those reels and short movies, and everything we want is shorter. So we do not even watch a complete video these days. Okay. So even the cognitive ability is lost because you're not able to think, you're not able to decide, you are not able to take any actions or do anything basically. Impaired socializing skills, we talk less, we chat more. So when we actually tend to talk, we are not able to find any conversations. Weakened emotional judgments and delayed learning in young children. Now, at least we have grown. We are in UGs and PGs. Imagine the children, imagine the child who's already sitting at home since the time they have actually been admitted to a school. And since then, they have zero interaction. They are not meeting new people. It's only the same people and some people on the screen. So, now what to do? Improving the day schedule. You plan your schedule, you plan your day accordingly that at least some time of the day I will devote in some physical activity. Need not necessarily you do hardcore gymming, need not necessarily कि आप एक sports ही खेलें. You can always indulge in walking on your rooftops, in your gallery, in your compound societies, and it should not be brisk walking ही करना है, 30 minutes walk ही करना है. It could be a walk and talk session with your friends. Improving workspace etiquette. That means have a good table chair relationship. And by that I mean एक चेयर जरूरी नहीं है बहुत हाई प्रोफाइल चेयर हो या आपको एक ergonomic chair ही चाहिए हो. You can make your regular chair into an ergonomic chair by making some modifications. Add a pillow below your hips, add a pillow at your back so that you are always well supported from the ground and from the back. Keep your feet touching the floor. Do not keep your foot dangling or do not keep your knee dangling in air. हमेशा जब भी आप लैपटॉप यूज करें make sure your elbow is at 90. That means elbow is directly below the shoulder and your elbow and wrist are also in 90 degrees. I'm sorry for this. So it's always in 90 degree and the elbow and wrist are also in line. So when you are doing your typing work, it should be like this. It should be in a 90-90 position. Your wrist should not be too much bent or too much down. It should be in a level while you're typing. So you may have seen कि लैपटॉप जहाँ पे आप रखते हो या जो डेस्कटॉप जहाँ पे रखते हैं कंप्यूटर के साथ एक कीबोर्ड के लिए स्पेस आया होता है. दैट इज फॉर द सेम पर्पस. आप कीबोर्ड ऊपर मत रखिए, उसी स्पेस में रख के यूज करिए और टेक इट टू योर लैप and have some physical activity. Improving workspace etiquette is known as ergonomics. Why I use the word ergonomic chair? So ergonomic, it is the scientific discipline that is concerned with the understanding of interactions among the humans and the elements of system. System means non-living system, non-living objects, and profession that applies theory, principles, data, and methods to design in order to optimize human well-being and overall systems performance. Your human body is also a system. So your interaction with your table and your chair will decide your posture. Your interaction of you and your phone. How do you use your phone? If you intend to read, आप अगर पढ़ने का शौक भी रखते हैं तो आप कैसे पढ़ रहे हैं? क्या आप दिन भर लेटे लेटे फोन यूज करते हैं? आप लेटे लेटे बुक्स रीड करते हैं? If you are doing that, stop it. If you are lying down and watching TV, stop it. Because this creates a bad posture overall. The spine is not in a proper position or a proper curve that should be maintained. The term ergonomic and human factors can be used sometimes interchangeably, and ergonomic is often used in relation to physical aspects of the environment, such as आपका workstation, आपका control panel, if I'm talking about people who are working in industries, and human factors कि मैं कितनी देर एक जगह बैठ रहा हूँ या बैठ रही हूँ. If I'm sitting more than like 30 minutes, 1 hour, I should get up and change my position first and then come back and sit. If I'm sitting in a long position for more than 1 hour, I should do some exercises on the chair itself. So benefits, it reduces costs in terms of everything, like costs in terms of your health, costs in terms of your medical um, billings, going to the doctor, and overall cost because it is improving your health. Improves productivity when you are in a good posture, in a without pain. You are going to work more. You will work more nicely and you'll be having good concentration. आपका सारा ध्यान आपके काम पे रहेगा, इस पे नहीं रहेगा कि मुझे बैक में पेन है, आई नीड टू लाई डाउन, आई हैव अ हेडेक गोइंग ऑन, ओके, इट इम्प्रूव्स द क्वालिटी, वॉट एवर यू आर डूइंग उसकी क्वालिटी अच्छी हो जाती है, एंड इट इम्प्रूव्स योर एंगेजमेंट, योर कॉन्सेंट्रेशन टूवर्ड्स योर वर्क. How to implement some rules? Sit on the chair adjusted according to your height with your head and back supported. So if you see here, ये जो foot है ये नीचे यहाँ पे टच होना चाहिए. अगर आपके बैक में और चेयर में इतना ज्यादा स्पेस है, हैव अ पिलो सो दैट व्हेनेवर यू आर रेस्टिंग यू कैन गेट अ बैक सपोर्ट. अगर आपका चेयर काफी हार्ड है, as in you're using a plastic chair or a chair that doesn't have a soft seat, use some pillows beneath also. Do not sit with any wallets in your pocket. Never sit with anything in your pockets. Free the pockets and sit, ताकि आपका जो स्पाइन है वो दोनों स्टेबल रहे. वरना जहाँ पे पॉकेट होगा that side is a bit raised and बाकी का साइड थोड़ा नीचे, causing a lot of problem. साइटिका जैसी प्रॉब्लम जिसे हम साइटिका कहते हैं, वो प्रॉब्लम्स भी काफी यंग एज में आजकल देखने मिल रही है. 18 inches is the normal screen distance that you should maintain from your TV screens or your desktop screens or your laptop screens. If you see what I was talking about, shoulder, elbow, and wrist, this should make a 90. Your wrist should be neutral, ना तो ज़्यादा ऊपर की तरफ ना ज़्यादा नीचे की तरफ मुड़ा हुआ. This height is probably good for this lady, but you can always adjust your height of chair. अगर आपको लगता है मेरी चेयर की हाइट एडजस्टेबल नहीं है, मेरी पर हाइट बहुत छोटी है, मैं डेस्क से बहुत नीचे हूँ, you can always use pillows to raise it up. But while doing so, your foot is not on the ground, so use footstools. If using laptop, keep the wrist neutral, elbows close to your body. Maintain an optimal distance from the screen to reduce stress on the neck and the eyes. You often tend to watch anything on the screen with this posture. That means the chin is pretty much forward, giving you pain here at the back of your head, जिसे हम tension type of headache बोलते हैं. So in case you constantly have headaches, the first thing you do is get your eye checkup done. If your eyes are having any issues regarding power, high tendency is you will always watch the TV with the forward head because you're not able to see it properly. So if you see here, this posture is bad because पूरा का पूरा आपका स्पाइन का कर्वेचर बदल गया है. अगर आप यहाँ पे देखिए स्पाइन के जो कर्व्स हैं वो मेंटेन्ड है. ओके, सो राउंडेड अपर बैक, हेड लीन्ड फॉरवर्ड, ये जो ईयर है वो शोल्डर से काफी आगे है, राउंडेड शोल्डर्स फॉरवर्ड. If you see this, relaxed shoulders and pulled back, open chest, level head and ears at the level of shoulder. So ear and shoulder are in level. So this is what is going to make a big difference if you started from today onwards. Now, use anti-reflective glasses if you are having a lot of screen time. Need like some people who are working currently in corporates, they constantly have to sit in front of the laptop, so use anti-reflective glasses. Okay, so do not sit or stand in one position for long and take breaks in between. Do tabletop exercises such as ankle pumps, that means moving your ankles up and down, neck rotations, move your neck side to side, and this will reduce the bad effect of long duration sitting. Check the eye level, make sure there is enough lighting in the room. बिना लाइटिंग के लंबे टाइम के लिए स्क्रीन के सामने बैठना is not recommended. Pay attention to your posture. The moment you feel, no, I'm stressed out, I cannot sit like this for long, get up, get moving, and take breaks. Now, how can you take breaks? What you can do, take a few minutes to relax. नीड नॉट नेसेसरी कि हर 15-20 मिनट में आपको खड़े होके चलना ही पड़े. हर बार पॉस्चर सिर्फ बदलना है. तो कैसे बदलना है? आप शोल्डर श्रग कर सकते हैं. सो आई वुड रिक्वेस्ट एवरीवन टू डू दिस एक्सरसाइज विद मी. कैन यू प्लीज स्विच ऑन योर कैमराज? I would request everyone to please switch on your cameras. Okay. जिन्होंने भी कैमरा ऑन किया है, let's just start. I would want you to do this exercise. This is a very good exercise for every student out here. So what you can do is just keep your hands folded in front of your chest, your elbows close to your body, and try to take the shoulders up. This is a simple shoulder shrug exercise. Keep it up, keep it for 15 seconds, count to 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, and relax. You can repeat this 3 to 4 more times and you will feel a very good squeeze in the upper region of the neck, which will give you quite a good relief in the pain. The other exercise that you can do is look up to the ceiling as much as you can. While doing this, your upper back is also getting a bit of contraction. The muscles over there are also working, which will give you a very good relief for the back. So I'll request you to do that. Try to look up as much as you can while making your back straighter, and keep this position for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. You can try and attempt this every 20 minutes or every 30 minutes if you are sitting for a longer period of time. Now coming back to our screen. So these are few exercises which we tried. This one, shoulder shrugging. Next is neck side turns. Just turn to one side and to the other side. Turn your head left and right. Head up and down we did. This is a bend exercise. This side of the muscle or this part of the area tends to get more tighter when you are in a longer sitting position. So you have to constantly stretch this area to avoid any kind of back pain or upper back pain. तो आप ये बैठे बैठे भी कर सकते हैं. So all you have to do is stretch yourself like this man is doing over here. Next is up down the legs. That means straighten your knee and bend it down. Now, a very good reason why you should do it. Our joints, they do not have good blood supply. They only get the nutrition when the movement is done. So this is a very basic thing that I would I want you to know, because half of the reason of the knee starts because we maintain the knee in a certain position. या तो हम bend रखते हैं या हम पूरा weight knee पे दे देते हैं, जिसकी वजह से सिर्फ बाहर के एरियाज में जहाँ पे कोई भी कंप्रेशन नहीं है या कोई भी फोर्स नहीं है, कोई दबाव नहीं है, वहां पे ही आपका न्यूट्रिशन रहता है, बट बाकी एरियाज में न्यूट्रिशन नहीं आता, जिसकी वजह से मेनिस्कल इंजरीज या आपके लिगामेंट टेयर के चांसेस बहुत ज्यादा बढ़ जाते हैं. एंड बेंडिंग फॉरवर्ड. There are few more exercises that you can try. Stand up at your place, arch your back, okay, and rotate your back, rotate your body. So pump your ankles, that is move your feet up and down, and these all you can do. And these are few stretches that you can try to avoid any postural problem. Okay, bending the sides, bending the arms and the wrist, stretching your whole entire back, stretching your upper area, stretching your this area by taking your hand back and stretching your wrist muscles. So these you can do over here. So we can do everything and yet not stop being Indian. So what we can do about being Indian though, use a small table, use pillows to comfort your back, use breaks to stretch your legs and back, do neck movements, keep yourself hydrated and blink often. So now we are done with this. Any questions, any doubts, you can definitely pour in.
मैम मेरा एक क्वेश्चन है, पोस्चर के रिलेटेड नहीं है, लेकिन बहुत सारे स्पोर्ट्स के जो बच्चे होते हैं खेलते
जी।
वक्त एंकल स्प्रेन होता है, तो
जी।
फर्स्ट एड हम क्या दे सकते हैं उनके लिए अगर ग्राउंड पे एंकल स्प्रेन होता है तो?
ओके, अगर आपको एंकल स्प्रेन हो रहा है एंड इट इज एन इमीडिएट इंजरी, द फर्स्ट थिंग यू डू इज यू अप्लाई आइस, अ लॉट ऑफ आइस थ्रू आउट द डे. एवरी 2-3 आवर्स थोड़ी आइसिंग करिए ताकि स्वेलिंग वगैरह आपकी कम रहे. एंड कंप्रेशन बैंडेजिंग, मतलब आप बेसिकली क्रेप बैंडेज बांध के रख सकते हैं. एंड मूव द एंकल पेन फ्री रेंजेस में, मतलब जहां तक आपको दर्द नहीं होता है वहां तक जितना बेरेबल है आपसे पेन, उतना एंकल का मूवमेंट करते रहिए. लेकिन अगर ग्राउंड में गिरने के बाद स्वेलिंग इतनी ज्यादा है कि विद इन 1 आवर या 2 आवर्स में वो बहुत ज्यादा स्वेलिंग क्रिएट कर चुका है, ऑलवेज मीट द डॉक्टर एज सून एज पॉसिबल, बिकॉज फ्रैक्चर के चांसेस भी हो सकते हैं.
थैंक यू मैम.
वेलकम सर.
आई थिंक अभी
एनीवन?
क्वेश्चन अगर किसी का नहीं है तो वोटर थैंक्स तो स्टार्ट करें.
Jay Shri, are you there?
Yes, ma'am. Hello everyone, I am Jayashri Ade from SYBS student of SARHAD College of Arts, Commerce and Science. I am grateful to here to express my gratitude for one and all for your valuable presence. Firstly, I thank Principal Sir of SARHAD College, Dr. Hanmant Jadwar, Vice Principal Dr. Sangeeta Shinde ma'am, for giving permission to arrange this program. With my deep sensation of appreciation, I would like to thank you, our today's guest, Assistant Professor Chinmay ma'am, for her valuable guidance on pandemic pain. Well, this sensation is very important for students and teachers. Also, I would like to thank you, our Assistant Professor Aparna ma'am, HOD of Science Department. Once again, I thanks all respected staff member and students for making this event successfully. Thank you so much.
Thank you, Jayashree. No doubt this session was really important for all of us in today's date, as we all are facing this deadly pandemic which is creating various health issues. As all good things come to an end, so as our today's session, I would like to conclude this session by thanking our chief guest and all our college staffs for giving their precious time from their busy schedule for us to make all of us aware about our health and fitness during this pandemic. Thank you so much.
Thank you everyone. Now you can leave everyone.
Thank you so much, everyone. Have a great day ahead.